Hello and welcome to Health Live at Seniors Today. We are delighted to welcome here Dr. Amit Singh, who is an interventional cardiologist, a distinguished interventional cardiologist and heart failure specialist, who's at the Kokilaben Dhirubhai Ambani Hospital in Navi Mumbai. Uh, we have invited him to speak about heart care for seniors. It's a very general topic, but September 29th is World Heart Day, and we thought it would be appropriate to have a session on that occasion on heart care for seniors. Before I invite him to speak, a little about him. He has been at the forefront of cardiac healthcare in the Mumbai metropolitan region, and he has trained at the prestigious say GS Medical College and KEM Hospital, and his expertise is in interventional cardiology and heart failure management, which is, as his profile says, he's unparalleled. He studied at the GS Medical College and the Grant Medical College and the European Society of Cardiology. Welcome to Health Live at Seniors Today, Dr. Amit Singh. How are you?
Yeah, fine. First of all, I would like to thank you for inviting me on this platform. And I hope to do my bit to educate everyone
Yeah,
on how to keep your heart healthy.
yeah,
I think there couldn't have been any better time than this to understand the importance of actually prevention.
I
So
agree.
we all know that prevention is better than cure, and we have to focus on prevention because prevention is something which is going to stay with us forever.
Right.
Okay.
Thank you very much, Doctor. Before you start the presentation, a small note as we've started doing now. This is being recorded on September 20th, 2025. So if you're watching it 2 years later, do check if there are some latest in terms of medical technology advancements that may have happened, and you may want to update yourself. As always, this session is being recorded, so do not worry about taking notes right now. Just listen in and post your questions to Dr. Amit Singh. It's not always that you get a senior and a very young, doctor who is there in the house on speaking about cardiology. So do take advantage of the fact that he's here and he will be answering all your questions. So over to you, doctor, and then we'll come back later for the questions.
Yeah, so I'll start with, so if you see, the first line of my presentation says, "Jo fit hai, wo hit hai." So this is true for all age groups, be it someone who is in their 20s or 30s, and also someone who is there in their 60s and 70s. Fitness is something which will, help you in the long run. So, jo fit hai, wo hit hai. So, so we usually feel that being healthy is just merely absence of sickness, but it's not true. That is not complete health. Health means you should be physically as well as emotionally, mentally, as well as socially should be healthy. That is what complete health is. So the aims of my presentation is to inform and discuss what healthy lifestyle means, to help you identify the health behaviors which you can incorporate in your daily life. Not that we are going to tell you some very elaborate routines and all. Some small behavioral changes which you can incorporate in your daily routine and which can be maintained in long run. And of course, in the end, we are going to take your questions and I'm going to answer them one by one. So, so there is something called as the holy four for keeping your heart healthy. Of course, it starts with the nutrition, some physical activity, and then staying away from bad addictions like smoking and drinking. So when we talk about preventing yourself from the heart diseases, so we have to understand that we cannot decrease our risk to zero. We cannot make it come zero by doing anything. So we can only reduce. We cannot make it absolute zero. Why? Because there are some risk factors which cannot be changed. These are called as non-modifiable risk factors. What cannot be changed? Your age cannot be changed. Your ethnicity cannot be changed. The country you are born, the geographical region you have been born in. Usually, Southeast Asians have highest risk of heart disease in entire world. Southeast Asian matlab people who are from India, people who are from Bangladesh, people who are from Pakistan, people who are from Sri Lanka. In fact, Pakistan has the highest risk of heart disease in entire world. In the second comes India. So these are something which we cannot change. Our genetic makeup, our ethnicity, heredity, we cannot change. And of course, age and gender also we cannot change. So that is why we cannot bring the risk zero. But of course, we can change few of the things which can decrease our risk. So what are these risks? We can take care of our cholesterol level. We can take care of our blood pressure. We can take care of our weight. We can take care of our diet. We can stay away from addictions like tobacco and alcohol. Also, we can, take care of our physical inactivity. We can be physically active. So these are the things which we can take care of. So we have to understand why I'm saying this. Many times, patients comes to me and say that, sir, I have been, living a very healthy life. I've been doing everything. Still, how I could get heart attack. So it is important that these are the people, like these are the cases where though the person has taken care of everything, still there are few things which cannot be changed. Just like I told you, the gender, the age, the ethnicity, all these things cannot be changed. So of course, there's some risk always stays, but our purpose, our goal is to bring the risk as low as possible. So we have to understand this thing. So I tell everyone that there are few numbers which all of us should be moving. Abhi, there are so many people over here who must be thinking that I'm completely okay and I don't need to do health checkups regularly. There is absolutely not needed. So it's not true actually. Health checkups, I wouldn't say a very elaborate health checkup, but there are few certain basic numbers which you should know, which you can know by the way of health checkups. That's why I would urge everyone to undergo at least yearly health checkups. So you should know your cholesterol level and triglyceride level. You should know your blood pressure level. You should know your fasting glucose level, whether you are in a range of developing a diabetes. You should know your body mass index, whether you're, going into an excessive obesity or being on overweight. You should know your waist circumference. And of course, you should exercise at least 30 minutes in a day for at least 5 days a week. That comes to 150 minutes in a week. So 150 minutes of a week is mandatory. So 150 minutes of moderate intensity exercises. When I say moderate intensity, for you all, it can be something as simple as brisk walking. When I say brisk walking, it doesn't mean like walking, you are doing a stroll in a garden. वैसा नहीं करना है. It should be fast. You should feel panting. You should feel air hunger. You should sweat. That is actually exercise in real sense. So the walking, just any walking is not sufficient. It should be a brisk walking. So that is what is basic minimum requirements. Basic. So what are these heart healthy behaviors? I'll again say that having a healthy diet, giving up on addictions, maintaining a healthy weight, some physical activity and sleep. That's all. That's all you have to take care of. Rest everything can be taken care of automatically. If you maintain all this, you will definitely have a normal blood pressure, you'll have a normal sugars, you'll have a normal cholesterol, you'll have a normal stress level. Everything will be automatically maintained if you take care of all these behavioral changes. So you have to stop smoking. If someone is already smoking, so you have to cut down on smoking. We all know that if you give up on smoking, you just not protect yourself from heart disease, but also you protect yourself from a lot of other cancers and other lung diseases like emphysema and bronchitis. So there are actually many health benefits of giving up on the smoking. So you have to think. So first you have to understand that why smoking is bad. You have to think. You have to determine yourself of giving it up. Then how can you actually do it? How can you quit the craving? So you can keep yourself busy. I understand in our age group you can keep busy by being with your friend circle, being with your spending time with your family. That is the way of keeping yourself busy. You have to be dedicated to cut down on smoking. You have to keep reminding yourself. Of course, family and friend support means a lot. And family and friend is something which is, which can either make it or break it. If the friends are also smoking, then you might be under peer pressure of continuing it. But if you have right set of friends, then they can definitely help you in giving up on smoking. You have to de-stress yourself. You can at times join few of de-addiction groups. And in the last, if nothing is working out, you can definitely take help from healthcare professionals in the way of nicotine patches, herbals, and few of the medicines which are available to cut down on smoking. And ultimately, in the last, don't give up because nothing is impossible. Now, smoking is done. So now coming to your healthy diet. So see, diet is something which I would say nobody can tailor make it for you. You have to understand what are our requirements and where are the places where you have to make changes. So when I say diet, it's not that you have to go to a dietitian and take a tailored diet. That is impractical. See, dietitians what they diet they usually tailor make for you, it is difficult to maintain or follow it for a very long term. What simply you can do is you can make changes in your regular diet. That way you can be actually follow that diet for a longer time. So when I talk about a healthy diet, how does a healthy diet should look like? It should be colorful. Your plate should like colorful, and the portion of each color should be nearly same. It should not be like just one color is an excessive. Like suppose you're having a rice and all your plate looks like full of rice only. So it should never be this. Everything have its own role. Even the carbohydrates are required. Even the fats is required. Everything has its own role, and it should be in equal and almost same quantity. So that is how your plate should look like. It should be colorful. It should be full of fruits. It should be some portion of vegetables, some proteins, maybe in the form of vegetarian or non-vegetarian sources of protein, and of course grains. Grains are required. Dairy is optional. Maybe you can add it or not. So what are things you can do actually? So when you're considering dairy, so what I would say, people have this habit of consuming milk. What a simple change you can do is you can switch from full fat milk to a toned milk. So people have this misconception. See, toned milk might not be having any nutrients. So it is extremely wrong. Toned milk has same amount of protein. It has same amount of minerals like calcium. Same. Only the part which is missing is the saturated fat. Okay, so that is what the toned milk is meant for. If someone is already having some problems like a heart problem, maybe blood pressure or diabetes or cholesterol, what simple dietary change you can make is that you can switch from a full fat cream milk to a fat free or toned milk. That is what is the simple step what you can do. Second thing is choose food with lower sodium. So sodium is something which is culprit for developing blood pressure. It is one of the culprit. So when I talk about salt intake, so in our country, if we compare as compared to the Western and the European population, our salt intake is almost 3 times more as compared to them. So when I say 3 times, our salt consumption is almost 9 gram per day as compared to theirs is between 2.5 to 3.2 gram per day. So we see it's almost 3 times. So why is it happening? Because our food items are full of salt. We require salt everywhere, which is not true in the Western counterpart. When I say Western counterpart, their indigenous diet, not the fries and burgers and all. I'm talking about the indigenous diet, the Mediterranean diet. So it is less. So why? So because we have habit of putting excessive salt, we have habit of having this concept of table salt, that we put extra salt on our tables when the food is placed on our table. We have to get rid of that. So the simple suggestion which I tell my patients from where we can start is that stop adding salt at tables. That is the first step. Second thing, what you can do is you can substitute your regular salt with a low sodium salt. Low sodium salt, already there are enough options in the market. You can go for anyone. What usually easily available for us is a Tata Light and Tata Super Light salt. You must have heard about it. It is a so these are simple dietary changes which you can do. You don't have to do some extra steps. It's just simple substitution which can actually help making your diet balanced. So salt. Now coming to salt, I have seen a lot of people have this misconception that pink salt or rock salt is better than the regular salt. So I would like to debunk this myth because there are two things which you have to take care of. One thing is if we have kids at our home and we are giving just the pink salt or rock salt, we have to understand that the growing kids have a requirement for iodine. And our government has fortified the regular white salt with iodine. Why? Because the content of iodine in our regular food items is very less. So there is always risk of these growing up kids of suffering from iodine deficiency. So that is why government in 1980s had this come up with this idea of fortifying the salt, which is taken up by everyone, from the poorest to the richest, to fortify it with iodine. So the problem with this pink salt and the rock salt, which are direct of the mined from the nature, they are not fortified. So there is risk of these kids developing iodine deficiency when you're taking them. Second thing is, of course, this pink salt or the direct rock salt have same amount of sodium as compared to the white salt. So if you want to go for a low sodium salt, then definitely pink salt and rock salt is not an option. So of course, if you're having blood pressure, if you're having hypertension, you should think about low sodium salts. And definitely pink and rock salt is a big no for myself. So I think that actually debunks a lot of myths around the type of salt which we should be having. And few people have this habit of having sugary drinks instead of water while having food. So if you're having such have bad habits, then you have to definitely give up and you have to stick to the plain simple water. So this is how your plate should actually look like. It should be mix of everything. It should not be just excessive of one thing. So small of everything is better than having one thing excessive, because excessive of anything is bad. So fruits and vegetable, I need not again mention it. I have already discussed about it. They are great source of oxidants, antioxidants, vitamins, minerals. At times they can make a good healthy handy and cheap snack, like a simple banana can be a good snack rather than munching on those chips. And also fruits have a lot of fiber, so they can help you with the constipation if someone is having a constipation. And also fruits have been found to reduce the risk of not just heart disease, but also cancer, stroke, and a lot of other diseases. So of course, fruits have some benefits. So you should consider, think of it. Vegetable comes first. You have to increase your intake of vegetables. Fruits are plus minus. Now coming to carbohydrates have already been put up in a very bad light. So it's not that all carbohydrates are bad. So carbohydrates are there are some called as complex carbs. I will not go into detail, but there are some as simple carbohydrates which are like sugars. So problem with this sugar is that as soon as you take them, they cause certain changes in the body. Simple is they cause insulin spike. I'm sure you all must be knowing insulin is a hormone. So when you have a direct sugar, there is a spike, there is a rush of insulin in our body. And insulin, initially it is okay for the body, but in the long run, if there is multiple spike, they start damaging the body. So you have to stay away from the simple carbohydrate. But complex carbohydrate like whole grains, millets, all these things are actually needed for the body, because your body also needs energy to function, right? So you need them. So you should be sticking to the complex carbohydrates and give up on simple carbohydrates like simple sugars, direct fruit juices, direct putting sugar in milk and all. You have to avoid that. Putting sugar, having lot of sugary tea and coffees. So I'm sure many people must be loving their tea and coffee. What simple change they can make in their routine is that they can substitute the sugar with no sugar. Or if they cannot have it without sugar, then they can substitute it with the sugar-free sweeteners. So there are multiple sugar-free sweeteners in the market. I'm sure you must have heard a lot of discussions whether sugar-free are safe or not. I'm telling you, they are definitely safe. In last studies, there have been only very few incidences of side effects, but largely they are safe and you can definitely substitute them with the regular sugars. Okay, so you one should not hesitate of going for a low calorie sweetness. So whole grains, I need not tell you in detail. So whole grains, we have to think about millets, we have to think about wheat, we have to think about our regular rice. But rice preferably should be non-polished, because non-polished contain more fibers as compared to the polished one. In proteins, what you can do, proteins, I'm sure you all can, consider having an egg. If someone has a limitation, they are pure vegetarian, then they can switch to soya bean and paneer. They are also a good source of protein. But egg is something which is complete source of protein because they contain all amino acids. So something as simple as that. Now, people, a lot of patients might ask if I am supposed to have protein, can I have non-veg as well? I say, see, the problem is not with the non-veg food. Problem is not with the chicken. Problem is not with the fish. The problem is the way we prepare, the way we Indians prepare it. So whenever we are preparing non-veg, we use excessive spices, we use excessive salt, we do deep frying or shallow frying, high temperature cooking. So that actually, kills the benefit of all this non-veg. They kills. So the harm becomes more than the benefit. So the problem is if you can have non-vegetarian, you can have, it's a good thing, but you're supposed to have it maybe in the form of a curry or maybe in the form of steaks, just like the Eastern Asian have, just like the Chinese people have, the Japanese people have. They don't use a lot of high temperature cooking, and that is why the risk of heart disease in them is less. But when we see in India, the type of cooking we do is slightly something which needs to be changed. Sugary food intake definitely have to decrease. So just like I told you, we have to cut down on our sugars, like in the form of sweet drinks, in juices, in the form of cold drinks. All these things had to be stopped. Coming to fat, actually, fat is something which I would like to discuss in detail. So when we talk about fat, for us, the source of fat directly is the usage of oil, the kind of oil we use, and the amount of oil we use. So I need to tell you this thing that Stop chasing for a perfect oil. There is no oil which is perfect. Okay, all oil using it. If you are using any oil in excess, all oils are bad. And if you are using any oil in very minimal amount, then it is as good as any other oil. So we have to understand, we have to stop chasing the ideal oil. What is the idea is how much we are using it and the kind of cooking we are doing it. So the problem is, see, whenever you heat oil to a very high temperature, there is formation of few harmful components called as trans fatty acids. And when you deep fry the food items in that trans fatty acids stick to the food items and then enters your body. And these are the trans fatty acids which are responsible for heart disease, for stroke, for kidney disease, and multiple of other problems. So the problem is the high temperature cooking and the using of excessive oil. So what we have to understand is we have to give up on frying, deep frying, high temperature cooking, even shallow frying. You can salt, that's completely okay. You can even use oil for salad dressing, like for dressings and all. That's completely fine. So it is not the oil, but the way we are using the oil, the temperature of the oil which we are using, that is more important. So when we talk about oils, which oil to use, there are some oils which are actually extremely bad and some oil which are as good as any other oil. So whenever we are using any oil, we have to understand we have to look at the label of the oil. So there is something called as monounsaturated fatty acids and polyunsaturated fatty acids. So MUFA and PUFA, the short forms are there. So you have to look at the oil you're using, whether it has a balanced amount of MUFA or PUFA or not. And the amount of saturated and trans should be less. I've already spoken about saturated and trans fatty acid. They are the culprit of heart disease. So any food items you are buying, you have to see any oil you are buying, you have to see the amount of MUFA and PUFA. So there is a habit called as label reading. If you're really very conscious citizen, what you can do is you can start reading for labels, especially if you're buying lot of food items from supermarket. It is being made mandatory by our government to label the amount of trans fatty acids and food items they are processed. So what simple habit which you can do or you can change is that you can start reading the labels of food items you are buying from the supermarkets. Omega 3 is something which has been, too much of talked about, whether you should take it, whether you should not take it. I'll tell you how do I advise my patient. So omega 3, if you are having a regular balanced diet, you need not take supplements. Young people who have lot of junks who frequently eat outside, for them at times it is indicated. But if person is having regular homemade balanced diets, omega 3 supplementation separately is not going to do any benefit. You have to understand. There are few food items which are high in omega 3 and some which are having a nominal or low amount. The high ones are definitely the fish, like the sardines, salmon, mackerel, and tuna. There are also some plant sources also, like you all must be knowing the flax seeds. The flax seed is a good source of omega 3. So you can consume all these, but I would discourage taking any kind of supplements. It's not required. Omega 3 definitely helps with the heart function, but let me tell you, it's not a magic for the heart health. It is not a magic. Heart health depends upon multiple things. Omega 3 just play a very minuscule role in that. So we have to understand. So this is important because many people, because of the social media, they have started taking like omega 3 is a superfood. If you take it, you'll stay healthy forever. It's not like that. Heart health is a mix and interplay of a lot of things, not just the omega 3. And I would discourage against routine supplementation of omega 3 fatty acids. So, what are a few of the things you can do to actually decrease the intake of your oil and fat intake? You can consider grilled or boiled or steamed type of cooking rather than frying and roasting. Cutting off all visible fats and removing poultry skin if someone is having excessive chicken or maybe meat. Going for a skim fat, you olive oil you can use instead of butter, but I would say for Indian cooking, olive oil is not a great choice because Indian cooking is a high temperature cooking. So olive oil is not the smoking point of olive oil is very low. So there will be a taste or change, the change of taste. So you can use, for me, what I preferably feel is the rice bran oil is something which is good because rice bran is something which has a very good smoking point. You can use it for deep frying also. It has few already added antioxidants like oryzanol. It also has vitamin E, and all the rice bran oil is something which you can use for reheating also. Like you can reheat it for 2 to 3 times, unlike any other oil. Even there is some concern of reheating with sunflower oil also and safflower oil also. So my personal preference, if we consider Indian cooking, it's something like rice bran. Now it might not be ideal, but if we see, we have to consider the cost issue also, the pricing issue also, and the regular practices in Indian cooking where we reheat the oil, we reuse the oil. Considering all this, if someone has to ask me which oil is suitable for Indian cooking, I would go with the rice bran oil. So I am telling you all this because these are the common questions which is commonly asked to me by my patients. Salt, I have already told you, we can go for a low sodium salts which are already available there in the market. Second thing is, if we see why the consumption of salt in the Europeans are less. It's not that they don't need salt, but what they do is they rather than directly consuming salt, they have something called as salt substitute. So what are the salt substitute? I am sure you all can recall whenever someone must have ordered pizzas from outside. There are two sachets or pouches which are received called as oregano. So what is this oregano? This oregano is a natural herbs which gives the taste. They are salty as well as spicy in taste. They have the typical taste and they can act like a salt substitute. So because they are salt substitute, there is no amount of sodium in that, and that is how they have been able to decrease their actually intake of salt from so many years. So these are just small things which we can make notice of it, and we can change our habits. We can also use their herbs for our regular cookings. So we can use them. So that is how we can do. Also, we have to take care that whenever we are going out, we have to tell the restaurant manager or maybe waiter that whatever you're preparing, just prepare in the low salt. What you can do is you can, if you're consuming lot of supermarket items or processed food from the supermarket, you can check the labels for the salt content and you can go for the substitutes which are having low salt. These are few simple things which you can change in your daily routine rather than sticking to a some tailored made diet which is difficult to follow for a very long time. So just like I told you, tips to reduce salt intake is don't add extra during cooking or at the table. You can use herbs and spices or lemon juice. You can look at the label and check for lower salt varieties. You can ask in the restaurant for no extra salt. And of course, no to chips, farsan and pickles. Pickles and papad are the highest source of sodium in Indian cooking. So if someone is already addicted to them, I would discourage to have them. The first thing you can do to control your blood pressure is by decreasing the salt intake. There is no point in increasing the blood pressure medication. Keep on increasing the blood pressure medication. No, that's not going to solve the problem. You have to take care of your diet. You have to take care of your diet. Now, maintaining a healthy weight, of course, we all know why it is important because excessive weight increases the risk of diabetes, blood pressure, which in turn increases the risk of heart disease, stroke. Of course, there are a few types of cancers also which are associated with the excessive weight. And there is something called a sleep apnea. Sleep apnea is a worse option of snoring. Many people snore. Sleep apnea is something like during sleep, there is collapse or choking up of the windpipe because of which patient keeps on waking up throughout the night. So excessive weight can be associated with sleep apnea, and of course, excessive weight can put excessive undue pressure on your knees and can cause osteoarthritis. So, so how to maintain an ideal weight? So it's a kid's question. So basically, if your input is less and your output is more, definitely you are going to lose weight. So what way you can do it? You can decrease your calorie intake. You can, and how you can decrease your calorie intake by being mindful of what you're eating. Being mindful. Another way is how young people are doing it is then they have started logging in the calories. There are multiple apps in the market. One of that app is Healthify. I'm sure many people must be knowing about it. So you can start logging in your calories and see how much you're actually consuming in a day, how much calorie. What I usually say is that for elderly people who are very mildly active, somewhere around 1200 to 1500 intake of calorie, 1000 calories is more than sufficient. So you can target your calorie intake somewhere between 1200 to 1800, but not more than 1800. So if you have a intake of around 12 to 1800, and then you have to check your output. Output means how much calories you are burning. So depending on that, so I have already discussed that minimum 30 minutes of activity is required for everyone. But if someone is actually actively trying to lose weight, they can increase their physical activity in the form of anything. It can be in the form of mild weights. Now, the purpose of lifting weight, which we also called as resistance training, is not to build muscle. We have to understand that when we do mild weights, there is when that muscle which we are training, when it comes under stress of the weight, it start releasing lot of hormones, good hormones. It start burning calories, it start burning triglyceride, and it start releasing hormone. This hormone helps in having a good sleep. It helps having a good mood. It helps in decreasing the blood pressure. It also helps in decreasing the sugars. So all these things, when in turn, when you're burning active calories, you lose weight. So we have to understand. So this is what I tell all my patients, especially who have crossed the age of 40, that when you start crossing the age of 40, you start losing your muscle mass. You start losing your muscle mass. The fat remains the same. The bone density more or less decreases very slowly, but muscle mass is something which reduces very rapidly. And what you have to do is, unless and until you are not doing something actively to maintain it, you will keep losing it on, and that is responsible for frailty. You know what is frailty? Means being dependent on others as you grow old. So you have to avoid that. So how you can avoid that is by actively training your muscles. And how you can actively training a muscle is by doing resistance training. Resistance training is nothing but some weight training. Now weight training, again I'm telling you, it is not to build muscles. It is just to maintain the muscles so that they don't stop getting wasted. You don't lose muscle mass. Now this is something really important in senior people, is because if your muscle mass is preserved, you will be self-reliant. You don't have to be dependent until the last day of your life on others. You are self-reliant, you are muscular, you are lean, you can do whatever you wanted. You can, without any support, you can lead your life very healthy. So this is what. So if you want to have that, I would say, a life with a dignity, not being dependent on your kids or anyone else, what you can do is you can maintain your health, maintain your muscle mass, be physically active, and that is the way you can decrease the number of injuries as you grow old. You reduce your risk of other diseases as well. So resistance training is something which is very important. Now many people will say ki, I should not be thinking about weight loss because I don't look fat. So fat, we have to understand, can be externally visible, like in the form of males around the abdomen, and in the female, especially as they grow old, around the hips. So some fats can be visible, but there are some fats which can be invisible as well. So what is that? These are the fats which are internally around the organ. And many people we have this also. So we see a lot of people, we call something called as lean diabetics. Lean diabetics means people who are thin and lean, still getting diabetes and heart disease. It's because these people might be having this kind of fat, that externally they appear lean and thin, but internally they have lot of fat. Now, this kind of fat is more dangerous. This kind of fat give rise to diabetes, give rise to cholesterol, and many other problems. So we have to think about this, that there are some fats which can be hidden. And how we can detect that? There's something. See, so I'm getting into details. So how we can detect this? By actually, there are a lot of weighing scales which have an additional feature called as body composition analysis. And in body composition analysis, you can actually see the percentage of fat in your body. So if you feel you're lean, you're thin, you can go and check whether you're really lean and thin from inside as well. You can check your body composition analysis and see the fat percentage. If you feel that you're lean and thin, but your fat percentage is more, then you have to think about losing weight. You have to think about doing some exercise for decreasing this body fat percentage to as less as possible. So being physically active, I have already told you, it can be something as simple as a brisk walking. You can also add it up with a simple stair climbing if you want to do it daily habits. And also you can put up some weights. You can do some weight training, maybe 2 kg, 3 kg, not more than that. You can do that. Okay. So, and of course, if someone has addicted to drinking, you have to cut down on drinking. Many people give this exercise that wine is healthy for the heart. No, no amount of alcohol is healthy for the heart. That's only thing is that wine has some polyphenols, which is antioxidant. But just having for consuming that antioxidant, you don't have to take the alcohol as a poison. You shouldn't be doing that. You can derive those polyphenols from fruits. You can derive those polyphenols from vegetables. You don't have to consume alcohol to consume that polyphenol. So no amount of alcohol is good. We have to cut down on alcohol. Also, we have to understand alcohol causes accelerated brain aging. So if someone who is consuming too much of alcohol, their risk of dementia, that is forgetfulness, increases. So if you have to keep yourself free from your dementia, if you have to be, keep your memory sharp, you have to keep your mind agile, you have to stay away from alcohol. Now coming to sleep. Sleep is something which has been ignored from very long time, but gradually we have realized the importance of sleep because sleep also play an important role in decreasing the level of stress in our body. If you are not sleeping enough, the stress level in your body is very high. When I say stress level in your body, it is a physical stress. Mental stress is a different thing. Physical stress. What physical stress? There is elevation in the level of stress hormones in our body. So stress hormones, what does they do? In short term, they are good for the body because they are like a fight and flight response. But in the long term, they damage the body. They start damaging the body. So sleep is something which takes care of it. So you have to sleep for at least 7 to 8 hours and it should be a continuous sleep, not in the breaks that you have slept 2 to 3 hours in the afternoon and 4 to 5 hours in the night. That's not going to work. It has to be a complete 7 to 8 hours sleep and preferably at the night because that is what is biological. That is what is going with our biological clock. It should be usually at the night. Excessive oversleeping and also too little of sleeping has a negative effect on the health and should be avoided. So, what are these? To summarize, what are these healthy behaviors? You have to give up on addictions. You have to make necessary changes in your diet. You have to be physically active. You have to be mindful of your weight, your blood pressure, your cholesterol level, your sugar level, and you have to get good, adequate sleep. Okay. So there is something called as life's simple 7 rules. So from that seven, it has become 8 rules now. So what are these 8 rules? You have to be physically active. You have to manage your blood pressure, cholesterol, sugars. You have to eat better. You have to lose weight. You have to stop smoking, and you have to have a good sleep. These are called life simple 8 rules to prevent heart disease. So I'll wind it up for that only. Okay, and if there are any questions, I would like to take them. Thank you.
Thank you, doctor. Thank you very much for your presentation. And we have quite a few questions that have come in already, and I think there's a lot of repeat, but I'll start with the questions, doctor. This is from Mr. Bharat Mehta, who's 68. His question is if he was operated and for one stent angioplasty in September 2020. His question is what precaution should a senior citizen like him at age 68 take to stop further heart issues?
Yes. So foremost important is that you have to keep following up with your doctors. You have to constantly keep checking for cholesterol level, sugars level, your blood pressure. Just like I told you, you have to be mindful of your weight. The third thing comes the prevention part. That is the diet and exercises I've already discussed. If you take care of all these things, I think like we should be pretty good to go.
Right. I think the same. There's a question from Hina Mehta who's asking after bypass surgery, what precautions should one take? Is it the same?
Yes, so if we take all these precautions, I feel there shouldn't be any problem in the future. But if we are not taking, adequate precaution, definitely, if once the blockages happen, it can always recur. We have to address the disease process, not the damage. So angioplasty bypass is that the damage has already occurred and we are trying to do the damage control. But we are not addressing the disease process. The disease process has to be addressed, and this can be addressed by already, as I have mentioned, you have to take care of all those risk factors.
Doctor, you did your presentation did feature a fair bit on diet, but there are still some questions which I'll just repeat. I'll just list all of them. Are millets better than wheat? What do you think
Yes,
about sugar-free?
I would say yes, but wheat has their own place, especially with regards to the taste and the wheat rotis are softer. What we can do is, what I usually advise my patients. See, many times now, few millets are not palatable, especially like ragi and all, though they have a lot of health benefits. So what I advise my patient, if the millets they are not palatable for them, or if we are not able to adjust to the taste, or if the rotis made by millets are too hard, what I advise them that you can mix the millet atta with your regular wheat atta in 50:50 ratio. That way you have the taste of wheat as well and the softness of wheat as well, and also get the benefits of the millet. So that is one way of incorporating them. But mostly all millets are better than the wheat, because the glycemic index with most of the millets are better as compared to the wheat.
Right. This is a question from Sunita Verma and a question from Shobha. Sunita Verma's question is: should we keep changing oils regularly, and is
That
it
practice is not needed actually. See, just like I told you, all oils are good, all oils are bad, depending how you're using them. So even if you're sticking to one oil, but you're limiting the amount of oil you're using, I think that's sufficient. You don't have to keep changing.
right?
But if you're using one of those bad oils like coconut oil, then definitely you should keep changing. So I forgot about this to discuss about this. So coconut oil is something which I would really discourage, because coconut oil is something which is less in MUFA as well as PUFA and high in saturated fats. So if someone is doing cooking in coconut oil, I would discourage that. The rest, most of the oils are good for Indian cooking.
And is it the question from Shobha is it true that cold press oils are much better than the regular oils?
See, I would say that I would not directly recommend that, because there is a cost involved with the cold press. Of course, it is good, but if you see the cost involved and the benefit which you get, it's not very much. So just like I said, I'll reiterate that all oils are good. Even if you go for a regular oil, that's fine. You have to limit the amount. If we see the cold press, it is slightly better, but the amount you're giving in cold press oil are usually 2 to 3 times expensive. We have to be considerate about the pockets as well. So I would say it's okay, but only if you can afford it. But it's not very, oh my God, or great as compared to the regular oil.
Right. I'm going to stop. I'm going to not take any questions on diet now, because we're going to have a special separate session on nutrition and diet.
Sir, answer this. I'm saying so is because this is something very important, and it's a big myth that is jaggery better than sugar. The answer is completely no. Answer is completely no, because the answer is very logical. Jaggery as well as the sugar which we Indians consume both come from sugarcane. And you have to understand that sugar is slightly processed. Jaggery is completely unprocessed. So when you have jaggery, there is direct entry of all the sugar inside your bloodstream, and it causes a rapid spike in the sugars in your blood and rapid insulin spike as compared to sugar. So jaggery and sugar both are bad. You have to understand. Jaggery and sugar both are bad. And in fact, in the places where someone is having a diabetes and is on insulin, jaggery causes a lot of problem in adjusting the insulin doses, because what happens, such patient whenever they have jaggery, there is sudden rise in the sugar level, and then we don't know how to control that. The sugar spikes directly. So jaggery is not better than sugar. We have to understand this thing. So this is what I wanted to tell. Many people have
Thank you.
this
And what about
misconception.
dates? What about dates, doctor?
So,
People.
sir, I'll tell you, see again. So, if we see now in a few of the countries, especially from Middle Eastern, they derive their sugar from dates and palms. So, again, dates are also high in sugars content, in calorie. If you want, so what you can do is again, just like no oil is good, no sugar is good, you have to decrease the amount of sugar you're consuming. You have to look for substitutes, places where you can substitute sugar with something else, just like I told you. So, I'll just give a very simple example, what I tell to my patient, if someone is, habituated to having tea, what I tell them that you can stop sugar and you can start elaichi. You can start putting cardamom in while preparing your tea. So at times, that elaichi or the cardamom actually neutralizes the taste of the bitterness of the tea, and you can actually start having a tea without sugar. I'm just giving a very rough example that once you start putting cardamom, you can get accustomed to the cardamom taste. It takes away the bitterness of the tea, and that is the simple way of you can taking away the sugar from your tea actually, rather than switching from regular sugar to date or maybe to jaggery. All those gimmicks are not required.
Right, great, doctor. So we'll move to other questions, which is one is from Mr. Ajoy Roy. He asks, is it good to take sleeping pills, W5 with 5 mg?
I would say if you're taking any pills, don't take it without your doctor's advice. And the doctor is the best person who's treating you, seeing on daily basis to understand whether you really need it or not.
Right. One last question, doctor. Is a blood thinner a must after a heart operation?
So we have to understand. So if someone has undergone any procedure, cardiac procedure, and already suffered a heart attack in the past, there are pretty chances that it can recur because that person has a tendency for it to develop. So when we give blood thinners, it is mainly for secondary prevention. Means one that thing has already occurred, it should not recur again. So that is the purpose of giving blood thinner. We have to understand that, and that is also purpose for giving cholesterol treatment. So many people feel that my cholesterol is normal. Why should I take anti-cholesterol treatment? We have we have to understand culprit is not cholesterol. Culprit is cholesterol in wrong place. We need cholesterol in our body to perform normal functions. Cholesterol is required for manufacturing or synthesis of hormones as well, which is required for our routine functioning. It is cholesterol in wrong place which is causing problem. So how do we prevent that? How do we prevent the cholesterol which is normal in the levels in the body from getting deposited at abnormal place is by giving those treatment, by giving the anti-cholesterol treatment. So once someone has suffered heart attack, someone is already undergone procedure, so that it doesn't happen again, we give blood thinner as well as anti-cholesterol, irrespective of how long it has been since he had that problem, irrespective of what are his cholesterol level or her cholesterol level. We have to give that.
Right. Thank you very much, doctor. Thank you once again to your team at Kokilaben Dhirubhai Ambani Hospital for facilitating this. Doctor, before you leave, I have a few questions, a few announcements to make. One is that we are going to be back again next Saturday at 5 p.m. But before that, tomorrow, that is the 21st, we are starting our first certificate course for senior citizens on mobile photography. Right. So if you are interested, the chat window is there. You can put your send your details to them. Also, of course, if you're in touch with the Seniors Today team, you can be in touch. From the 25th, we are starting a certificate course in karaoke singing. Okay, and this is again especially for senior citizens. I'm going to just stop at this, Doctor. There's a question that has come in, and I think we should take it. This is Mr. Devendra Shah. He says, I did not have a high heart attack. Why I'm asking is, taking thinner, does it make veins thin and skin also?
No, if you have not had any heart attack, then blood thinners are usually not required. Cholesterol treatment is required at times because cholesterol is something which at times we give for primary prevention also. Blood thinners are given only in specific scenarios when the risk of patient developing the first heart attack is very high. So again, that risk needs to be calculated and can be calculated by your cardiologist whom you are showing already. So it has to be, if it is required, the doctor will tell you, they will risk calculate and then they will prescribe. Otherwise, we should not be taking by ourselves.
Right. Before you leave, doctor, we'll just have a video on our latest issue of Seniors Today, which Seniors Today is a magazine which comes out every month on the 15th of the month, and the last issue was out on the 15th. And we're just going to place a short video. But doctor, thank you very much. Okay, here's the video. Thank you, and thank you to Dr. Amit Singh and his team at Kokilaben Hospital for facilitating this. We will be back once again next Saturday at 5 p.m. for another session on Health Live at Seniors Today. I must give you a preview of what we're going to do next week. Is we have our dental specialist, Dr. Asha Narde, who's going to be speaking about age-related dental issues. So do be there, and you can always, as always, ask all your questions. Do remember that this session will be there on our website, seniorstoday.in, on Monday evening. So you can check out the video, check out the takeaways, which are written by a medical practitioner. Thank you very much. And okay, there's a question, there's a message from Dr. Amit Singh which has come in, and it's very nice of you, Doctor. This is from Dr. Amit Singh. He says, please drop your questions to Amit Singh, KEM Med. Okay, Amit Singh, KEM Med at gmail.com. Okay, KEM Med is because, I guess because he was at GS Medical, a student of GS Medical and KEM Hospital. So Amit Singh, KEM Med at gmail.com. Do send in your questions to him directly if you have, and he will answer it for you. Thank you very much again, Doctor, and thank you, all of you. Bye-bye.
Subscribe now and press the bell icon. Never miss an update.